regarding the timing of follow-up, it's important to ensure appropriate timing based on the factors we discussed. If there is a public holiday coming up, you should have that factored in as well, both in the discharge plan as well as in the follow-up plan. And also the appropriate feeding advice should be given before we discharge the baby. The assessment at follow-up should include the baby's naked weight and the percent change from birth, adequacy of intake, pattern of voiding and stooling, and jaundice assessment. If the mother is starting to feed well, we should give her signs of improved milk output, like increasing urine output, baby satiety, and so on. And we should have an alternative option to advise her if there are signs that the baby is not getting enough milk. So earlier follow-up can be advised in those instances, or the mother can come before the scheduled appointment. We should also be aware that poor feeding can lead to hypernatremia, which can be causing brain injury as well. So feeding, jaundice monitoring, and appropriate weight gain monitoring are important. We should request the serum bilirubin if the transcutaneous bilirubin is over 220 to 240 micromoles, 12.5 to 14 milligrams per cent. This is because this is a rough guide, it's not the exact indicator, and the bilirubin result can be plus or minus 2 to 3 milligrams above the reading on the transcutaneous. So if it is above the level, it may fall in the treatment zone. We should ensure adequate hydration and support feeding. We should plot the bilirubin on our specific nomograms. Phototherapy is a mainstay of treatment if the baby falls in the treatment level, and I discussed the criteria for deciding on the treatment. Unconjugated bilirubin absorbs the light most strongly in the blue region of the spectrum, which is near 460 nanometers. The direct bilirubin, the direct relationship is there between efficacy of phototherapy and irradiance. So the age of the bulbs that are used, the height at which it is kept, the number of lamps that are used, possibly increase the surface area by using a billy bed, or you can use a billy blanket. So this is the American Academy phototherapy chart, which gives us 3 lines based on the risk. So infants at lower risk, infants at medium risk, and the infants at the highest risks, and the treatment cutoffs are obviously different. It's also different up to the age of 72 hours or so, after which it's a plateau.